Hi guys, it's Karen Collum, Program Director of Ignite Healthcare Institute here in Greenville, South Carolina, and we are putting together a series of lectures and presentations so that our students can complete the South Carolina Certified Nursing Assistant Training Program during this COVID-19 season of our life. We know there are challenges to this, and we appreciate your patience in trying to work through each of these modules. This is a short presentation just to orient you to your skills booklet. We briefly spoke about it in class today, and each of you received the South Carolina Skills Test packet. We mentioned to you that there are 22 skills in the skills book that you all will be responsible for knowing. When we go to class tomorrow, you will have the opportunity to practice the first 3 skills in the series. These skills come from Module 4, which includes transfer to wheelchair using a transfer belt, ambulate using a transfer belt, or position on side. So there will be 3 skills that we'll be referring to. Before we get to the details of those individual skills, there are a few things I want you to do with your skills booklet. You will notice that most of your skills start with some sort of introductory statement, such as introduces self to client or explains procedure to client. Therefore, one of the practices that I have made as an instructor is to ask all my students to begin the skills the same way every time. So we'll start every skill with knocking on the door and using this phrase. Hello, patient's name. My name is your name, and I'm your CNA for today. We're going to go ahead and get you up for a walk. Before we get started, let me close the door for your privacy and get my hands washed. If we will use the same introduction every time, it lessens the anxiety as we get ready to perform the skills. It also ensures that the first couple steps of every skill you will receive credit for during the state exam. Now, I do realize that there are several skills that don't have an introduction, such as dental care or measuring urine. Those don't have a formal introduction because those skills are done outside of the client's room. So it wouldn't be necessary to knock on the door and say, "Good morning, dentures. My name is Karen, your CNA for today, and I'm here to brush you." However, again, if you'll just trust me on this and use the same entry every single time. We're also going to have a similar exit strategy. Again, if you look through the skills manual, you will see that almost all skills finish with ensuring that your client has their call light and making sure that you've washed your hands. So at the end of each skill, I will also require you to say, "Here's your call light. If you need something, let me know," and then verbally indicate that you would wash your hands. During the state exam in South Carolina, the first skill that you will demonstrate will be hand washing. Therefore, second and subsequent hand washings during the skill performance, you may verbalize. So you will be able to say, "wash hands," without physically having to go to the sink and rewash the hands. What I'd like for you to do for a moment is I'd like for you to pause the video, and I'm going to ask that you take your skills book and starting with the hand washing skill, I would like for you to spend just a few minutes going through the skills book and identifying a couple things for me. I'd like for you to identify, of the 22 skills, how many of those skills have an introduction. I'd also like for you to identify, of the 22 skills, how many require that the door be closed for privacy. Also, of the 22 skills, how many do you need to ensure that the call light is in place? And finally, of the 22 skills, how many do I need to wash hands? You're going to find these numbers are pretty high, but it proves a point that I want you to be sure that you're very familiar with the skills book. So I'm going to pause for just a moment, give you just a few minutes to look through that, and we'll be right back. All right, so hopefully you had a chance to look through that. Hopefully what you were able to find that on the introductory, there are 22 skills and there are 19 that require an introduction. The 3 that do not are dental care, measuring urine, and donning PPE. The second one was to identify door closed. 14 of the 22 skills do require that the door be closed for privacy. Again, I think if you'll trust what I'm having you do, I would rather you close the door for privacy on every skill than try to remember which 7 or 8 do I not need to close the door for. On the third one, which was ensuring they have a call light within reach, 17 of the 22 had that. And on the final, hand washing, all 22 required that hands be washed at the end. So again, in preparation for the skills evaluation, please keep in mind that we will continually have you do the intro and the exit the same way every single time. So again, for example, tomorrow, we will say, knock, knock, knock. Hello, Miss Jones. My name is Karen. I'm your CNA for the day, and we're here to transfer you to the wheelchair. Before we get started, let me close the door for privacy and get my hands washed. We will then demonstrate the steps involved with transfer to wheelchair, and as we're finishing the skill, we will say, Ms. Jones, here's your signal device or call light. Please let us know if you need anything, and then verbalize that you would wash your hands. Again, as we proceed, this is a very different process for us. But what we will do is I will first ask that you look at the skills book and that we go through the steps and verbalize them. Secondly, I will then have you watch the skills video in which I am demonstrating the steps to perform that skill. And finally, we will enter the lab and we will actually have the opportunity to be checked off on those skills. In a separate module, there is a folder for the 3 skills for Chapter 4, ambulating with a transfer belt, transfer to wheelchair, and position on side. So again, you might want to pause the video at this time and look at those 3 skills for a moment. As you can imagine, when you're getting ready to take your state exam, your anxiety level is pretty high. We want to be sure that the steps are all met to meet the obligation of the exam. As we mentioned, you will need to get 80% of the number of steps for the skill. Skill steps range from 5 steps in a skill all the way to 19 in a skill. Again, I'll remind you that anything that is a bolded item is an automatic failure. So we again will learn ways through the course to ensure that we don't miss those steps and we get used to what we need to identify as automatic failures. Also, with each set of skills, I'm going to try to give you some phrases or mnemonics or things to try to remember some of the steps as well. So one of the things that we're going to remember is the phrase, when you walk, you lock. That means if I'm getting a patient out of the bed for any reason, I'm going to ensure that the bed is locked and in the lowest position. So remember, when you walk, you lock. Again, for Chapter 4, 2 of those skills involve transferring the patient out of the bed, and you will need to make sure the bed is locked in the lowest position. You'll also need to remember that when you walk, you lock with shoes, meaning again that if your patient is getting out of the bed for any reason, we ensure that the client or resident does have shoes on for safety. Okay, I think we're about ready. So we will have the opportunity tomorrow to get in the lab and demonstrate these skills. Please be assured that we will have multiple opportunities to be in the lab to perfect the steps and make sure that we know what we're doing. Tomorrow's just our chance for the first time to get checked off and be ready to move forward. This is a new video series. Again, it's something new that we're trying. I will encourage you to go ahead and like it or dislike it. It helps with feedback. I had mentioned earlier that really didn't matter, but I do want to know that we're meeting your needs doing this class virtually. Also, we are going to go ahead and put a subscribe button on there so that you can, again, get to this as frequently as you need to by subscribing to KD Medical Service. Thanks. See you tomorrow.